Hey everyone, I'm Heather Cook. I'm one of the physicians here at Coastal Fertility. We're going to be doing a Facebook Live today. Real quick discussion about a very important topic, and that is of family building options for our LGBTQ plus community. There are a lot of options. I could probably talk for hours about this, but we're going to try and kind of consolidate into about 10-15 minutes here and just kind of go over the basics. So I think the first take-home message is that there are a lot of options, and depending on the couple situation, kind of what their desires are. We have a lot of options to offer our patients in this realm. So we're going to kind of break it down and go through some individual options here. So first I wanted to just talk about options for our same-sex female couples, which again, there are a lot of options. It really depends on the couple's desires, on who wants to carry the pregnancy, whose genetic material, meaning whose eggs are we going to be using. And so there are options in realms of those kind of treatments. So we'll kind of talk about it as in partner one and partner two. So probably the simplest option we have is if the same partner, let's just say partner one, wants to utilize their genetic material, meaning their eggs, and also wants to carry the pregnancy. And so in that situation, we often will recommend something called a natural cycle IUI utilizing donor sperm. We work with a lot of different sperm banks and would guide you through the process of kind of selecting an appropriate sperm sample from a sperm donor. We generally would let the patient kind of ovulate on their own, keeping it very simple, not using a lot of medications and kind of tracking ovulation, and then just simply performing what's called an intrauterine insemination on the day of ovulation, where we can kind of deliver the donor sperm into the uterus. So that's probably the easiest, most simple way. Again, if we are using the same partner's eggs, and they're the ones that are going to be carrying the pregnancy. Now, if we do have some other underlying fertility issues in that patient, or we're not having success with the simple options, of course, we can be a little bit more aggressive. We can add on medications and kind of do the same process with the donor sperm IUI. We even can do, traditional IVF in that situation where we're doing an in vitro fertilization, a more aggressive treatment, but still utilizing partner one's eggs and having that same partner carry the pregnancy. Now, we also offer something that is sometimes termed co-IVF or reciprocal IVF. And that's an option for patients where one partner may want to utilize their eggs or genetic material, but the other partner wants to actually carry the pregnancy. And so that's a little bit of a different process where we would put the partner whose eggs we're utilizing essentially through an IVF cycle, an in vitro fertilization stimulation, where we're using medications to grow eggs and utilize those eggs. We would be able to fertilize the eggs with a donor sperm sample, and then those resulting embryos could be utilized to transfer into the second partner's uterus for her to carry the pregnancy. So again, that option is called co-IVF or reciprocal IVF, and again, that's intended when one partner wants to utilize their eggs and the other partner wants to carry the pregnancy. And we do those cycles quite a bit. We have a lot of couples coming in wanting to do that from the get-go, so those work very well. We can kind of guide you through that process. So I think that covers most of the options for same-sex female couples. And again, we would encourage you to come in, get some testing done so we can kind of tell you and your partner which of those options may be beneficial for you, based on your desires and what you want, and also what the testing is showing us as far as egg counts, uterine quality, all of those things to give you guys the highest chance of having a family. So now we'll kind of move on to our same-sex male couples. So in this situation, we're a little bit the reverse situation where now we do have sperm to utilize, but we are in need of eggs and we're in need of a uterus to carry the pregnancy. And so for the egg portion, we're going to need something called egg donation, where we utilize either known or anonymous women to donate eggs. Those are called egg donation IVF cycles. And again, we have a fairly large egg donation program here and could easily guide you through the different options in selecting a donor and getting the eggs from the donor to utilize. So that would be the process of how we would get the eggs to use. We have options as far as how we fertilize those eggs. We may have a couple that wants to just utilize one partner's sperm to fertilize all of the eggs and get embryos. We have some couples that want to fertilize eggs with both partners' sperm and have embryos with both genetic material, so that's an option as well. So again, that would be a discussion just as far as what the couple would want. When we have the embryos made, now we get into the second part where we need a uterus to carry the pregnancy. That is a process called gestational carrier IVF, or it used to be called surrogacy. And so we are going to get a woman who we have screened, tested. We feel confident that this person is, going to be able to give us a safe, healthy pregnancy. Excuse me. And we would take our embryos that have been created from the egg donation process and usually one at a time place those embryos into the gestational carrier's uterus to carry the pregnancy for us. And again, we do a lot of these types of cycles, so this is something that our team can easily guide you through as far as the selection of the egg donor, the gestational carrier, doing all the appropriate screening and testing and getting a pregnancy and a child from that process. So again, that's kind of in a nutshell the process of what we would offer for same-sex male couples. Moving on to another topic, which is our transgender patients. There's a lot more variability in that realm, just depending on the situation of the patient and the couple, meaning have we already transitioned? Are we in the process of transitioning? Are we thinking about transitioning? Are we going to be using eggs or sperm, depending on the direction of the transition? So what I would say for that is anyone who is in that situation or thinking about making that transition, it's probably a good idea to get a consultation with a reproductive endocrinologist really before starting any hormone treatment, because usually when we're doing either an egg harvest or getting sperm to utilize later on, we do want that, without any hormone involvement prior to the transition. And that'll usually be a good consultation to give you your options and potentially get eggs or get sperm before you start through the transition, so you'll have more options later on. So any other questions in that regard, we would definitely encourage a consult to review your specific situation and health history and figure out what would give you the highest chance of getting a pregnancy either now or in the future. So I think that covers the main options for some big groups of our patients. I will say that any time that we are doing anything where we are utilizing donor sperm, donor eggs, a gestational carrier, those are a little bit more complicated fertility processes. We have a full team of nurses and assistants here at Coastal that just work with our patients using donor sperm, donor eggs, or gestational carriers, because it is a little bit of a more complex, higher level of care cycle. And so we really need to make sure that we're doing everything we can to protect you as patients. We need to make sure we're doing all the appropriate screening of our sperm donors, egg donors, gestational carriers, which includes a little bit of extra infectious disease testing, genetic carrier testing. There usually is going to be a reproductive lawyer involved. As you can imagine, we usually have legal contracts when we're using donor sperm, donor eggs, or gestational carriers, just to protect your rights as the patient, to protect your rights and your partner's rights to the child when it's born. So we really want to make sure all that's done correctly beforehand so that it doesn't cause you any problems later on after your baby is born. And again, our team of nurses and assistants would guide you through that whole process in coordinating with the egg donor, the sperm donor, the gestational carrier, the legal, the counselors, and all of that. And so it's nothing that you need to be afraid of. We can give you all the information and guide you through it pretty easily and pretty quickly. So I hope that that answers some basic questions that anyone may have about the process. Again, if you're in any of the cases that we talked about and just want to get some information on your specific options based on your health history and your relationship status, I would encourage you to come and see one of our physicians, and we can guide you through all the recommended testing and give you all the options that you may have. I think that's probably it as far as today's talk. Do we have any specific questions at all, Holly? Okay, so everybody have a great day, and we look forward to seeing you in the office. Again, if you have any other questions on the topic. Thanks so much.